A law in California that will boost the minimum wage for healthcare workers was signed by Governor Gavin Newsom last year and was supposed to go into effect on June 1st. But less than a week before that happens, Newsom and state lawmakers are looking to postpone the implementation of a $25 minimum wage for nearly all workers, including janitors at healthcare facilities. The law is one of the most expensive the state has seen in years, expected to cost $4 billion in just its first year, according to Newsom's administration. But the costly tab comes as the state is already spending tens of billions of dollars more than what the annual budget allows. The state's budget deficit is roughly $45 billion. Unions have promoted the legislation as a fix to a healthcare system that is losing critical staff due to its low pay. After news of Newsom looking to walk back the minimum wage legislation until a fiscal solution is in place for it, a union representing United Healthcare Workers launched a campaign aiming to hold the governor to the law he signed in October. Healthcare workers shared why they don't want the legislation to be pushed back. A technician says, "It's no secret why we are short-staffed. It's the low pay." A nursing assistant says, "On one of the worst days, there were only 2 of us certified nursing assistants to care for 38 patients." A dialysis patient care tech says, "A lot of good people have left because of the low pay." The current minimum wage in California is $16 an hour. The wage increase associated with this legislation would phase in over the next few years. As things stand, that minimum wage for the sector would increase next month to $18 to $23, depending on the job title in place. But by 2028, nearly all workers in healthcare facilities would have to be paid at least $25 an hour. While that's the tentative plan, the state legislature is looking to bump that pay boost back, at least until July 1st, which is when the new fiscal year begins. Newsom announced the hesitation in January when going over the next fiscal year's budget and estimating the already $45 billion deficit would grow to $56 billion over the next 2 fiscal years. According to Newsom's Department of Finance, half of the cost burden of this wage increase would be on the state's general fund. The other half would be paid for by federal funds. California's Department of Finance is against the legislation, saying in a bill analysis report, finance is opposed to this bill because it creates significant general fund impacts and cost pressures. This bill will also create significant economic impacts in the healthcare industry, which may increase costs for consumers and the state. The author of the bill submitted paperwork to delay its implementation by 1 month. California state legislature is expected to vote on the amendment this week. I'm Kara Rucker. For more stories like this, download the Street Arrow News app or visit us at san.com.